Just like a hook, hookworms have a straight body, with their heads often curved in the opposite direction, giving them a hooked appearance. These characteristics are typical of adult hookworms. Shockingly, these worms pose a greater danger than you might expect as they attach to the lining of the small intestines, where they feed on blood. This can potentially lead to serious tissue damage and blood loss. There are several types of hookworms that affect humans. The primary ones are Ancylostoma duodenale, originally described by Dubini in 1843 in Italy, and Necator americanus, identified by Stiles in 1902 in specimens from Texas, USA. Interestingly, Necator americanus literally means American murderer, and this worm is commonly referred to as the New World hookworm. In contrast, Ancylostoma duodenale is usually known as the Old World hookworm. These two species can be differentiated by the morphology of their oral cavities, with the Old World hookworm possessing 4 sharp tooth-like structures, and the New World hookworm having dorsal and ventral cutting plates. The adult size of the Old World hookworm is larger and thicker, while the New World hookworm is smaller and slender. These adult worms can be pink, grayish-white, or may appear reddish due to ingested blood. Old World hookworm can consume an estimated 0.26 milliliters of blood per day, while the New World hookworm consumes an estimated 0.03 milliliters of blood per day, which is a significant difference. Though quite rare, there are other species of hookworms that can infect humans. These include Ancylostoma caninum, primarily a parasite of domestic and wild canines, Ancylostoma tubiforme, usually infecting cats, Ancylostoma brasiliensis, and Ancylostoma ceylanicum, both of which infect wild and domestic carnivores. While the larvae of these species can infect humans, they typically do not reach adulthood in human hosts. Instead, they are mainly associated with a condition known as cutaneous larva migrans, where their filariform larvae migrate under the skin, causing a condition known as creeping eruption. This manifests as reddish, itchy papule along the path traversed by the larvae. The adult worms reside in the small intestine, where they employ their mouthparts to grip the mucosa and lacerate the underlying tissue. Subsequently, these worms feed on the blood that seeps from these wounds. Notably, they do not remain stationary, but rather move around the gut, leaving behind ongoing bleeding wounds. Furthermore, these worms consume more blood than necessary and excrete a significant portion of it before it is fully digested. This inefficient process results in a substantial depletion of the host's blood, significantly increasing the risk of anemia. Hookworms exist as separate male and female sexes. After mating, the female releases eggs that are expelled with the host's feces. Hookworm eggs generally share a similar appearance, making it challenging to identify them by species. As long as they are maintained in a warm and moist environment, these eggs continue to develop and eventually hatch, usually within 24 to 48 hours, releasing free-living first-stage larvae. These larvae have a rhabditiform esophagus and feed on bacteria and other materials in feces and soil. In regions with warm climates, fresh feces readily attract numerous coprophagic insects, which not only churn and aerate the feces, but also incorporate the fecal material into the soil. This process enhances the conditions for the growth of hookworm larvae. After approximately 2 to 3 days, the first stage larvae undergo molting to the second stage, where they continue to feed. They then molt again after about 5 days, reaching the infectious third stage. The third stage larvae are known as filariform due to the absence of a terminal bulb or isthmus in their esophagus. They do not actively feed, but their intestines contain sufficient stored food particles to sustain them for several weeks. These third-stage larvae typically retain the cuticle shed by the second stage, serving as a protective sheath. However, this sheath is lost when the worm invades a potential host. In the soil, infectious larvae position themselves in the top layer but can move up or down the soil profile based on moisture levels. When they detect a suitable host, the larvae employ a combination of physical boring and chemical release to penetrate through the host's skin. They are very thin, allowing them to navigate through skin cracks or penetrate hair follicles. After successfully penetrating the epidermis, the larvae travel to the blood vessels or lymphatic system, where they are transported through the circulatory system to the heart and subsequently to the lungs. From there, they penetrate the alveoli, enter air spaces, climb up the bronchioles, and eventually reach the bronchi before proceeding to the trachea. Finally, they are swallowed down the esophagus. Once the filariform third-stage larvae reach the small intestine, they molt to the fourth stage, characterized by an enlarged buccal cavity. Here, they attach to the intestinal mucosa. The fourth stage larvae then molt into the adult stage, at which point mature worms mate and begin egg-laying. The entire life cycle from skin penetration to egg-laying typically takes around 5 weeks, although in some species it can be longer due to a period of delayed development. Adult hookworms can have a long lifespan, persisting for several years if left untreated. Hookworms are responsible for clinical manifestations at 3 key stages in their life cycle: during the initial invasion through the skin, while migrating through the body, and as adults when consuming blood in the small intestine. When larvae penetrate their usual definitive host, the host's reaction is typically not severe, although it may introduce bacteria that trigger a localized acute inflammatory response. In humans, penetration generally occurs through the feet, but other body parts may also be affected, for instance, if a person was sitting, kneeling, or lying on the ground. In cases where humans are infected by larvae of species like Ancylostoma caninum, Ancylostoma brasiliensis, and other species that typically parasitize other animals, a condition known as cutaneous larvae migrans may occur. These larvae cannot move beyond the basal layer, and as a result, they wander just beneath the skin surface for weeks or even months until the immune system eventually eliminates them. During their wanderings, they create long serpentine tracks that are intensely itchy and painful due to physical damage and the acute immune response. The damaged tissue is often secondarily infected by bacteria, either introduced by the worm or as a consequence of scratching, which further intensifies the clinical manifestations. During the migration of larvae through the lungs and the presence of adult worms in the intestine, the clinical manifestations are highly dependent on the number of worms involved. Small numbers of worms may cause minimal damage with no noticeable clinical signs, while large numbers can be life-threatening. In cases where a substantial number of larvae pass through the lungs simultaneously, they can induce respiratory distress and pneumonitis. The impact of adult worms depends on their numbers and the nutritional status of the host. A single adult Ancylostoma duodenale consumes approximately 0.26 milliliters of blood per day, so the presence of a few worms has little effect on health, and some even consider low worm burdens beneficial for maintaining a healthy immune system. However, as the number of worms increases, the amount of blood lost can quickly become significant, especially in individuals with inadequate nutrition. Blood loss due to hookworm infection leads to iron deficiency anemia, and the color of feces can turn red or black depending on the extent of blood loss. Hookworm infection also results in various symptoms such as fatigue, weakness, and pallor, most of which can be attributed to the consequences of iron deficiency anemia. Uncommonly, hookworm infection can cause reverse iris dilation reflex, where the pupil of the eye dilates in response to strong light instead of contracting. Additionally, it has been suggested to stimulate the consumption of soil, known as geophagia or pica. In children, chronic infections can lead to stunted physical growth and mental retardation. To address hookworm infestation, it's crucial to understand how it is diagnosed and treated. The diagnosis of hookworm disease involves examining direct or concentrated stool specimens for the distinctive eggs. Treatment is essential for correcting anemia, which can range from mild to severe. In mild to moderate cases, iron replacement is usually sufficient, while more severe anemia may necessitate blood transfusions. To combat hookworm infestation, 3 highly effective anthelmintic agents are commonly used: albendazole, mebendazole, and parental pomoate. Preventing hookworm infection involves not only improving sanitation, but also wearing shoes, as this provides a defense against skin invasion by filariform larvae. I hope you've learned something valuable from this video. Thank you so much for watching and subscribing. I'd love to hear your thoughts in the comments below, so don't hesitate to share your feedback. And don't forget to check out my other videos if you want more great content. Cheers, and see you in the next one.